Hello there, I'm Kendall, and this is The Objective, and welcome. And we're here today because, as you probably know, it's pandemic time, which means we have a lot of time around the house to do cleaning and find old things we've lost. And so that's what I've been doing, like finding this awkward thing that I have no idea what it's for. So, after a lot of time researching, looking around, fumbling around, I was able to find what I think is a really cool story. In this book, also conveniently placed within grabbing reach on our bookshelf. This is a good story, a story that I'm going to share today. It's a story about a young country, a country that has its entire hopes and dreams right in its foresight, something it's been working for years, decades even. And right as it's about to get those dreams, the Spanish flu comes. And then it has to spend some time deciding what's most important, helping people or fulfilling dreams. And that story is the one I'm going to share today. So let's get to it. So where to begin? I think the best place to begin is to put ourselves in the mindsets of the people that lived and breathed in 1918 so we can understand what it was that they were competing against other than the flu. Summer and fall of 1918 was a critical time for the world, and for the US specifically. For the last 4 years, the world had been in the worst conflict it had ever seen. Millions had died from mustard gas, bombs, tanks, chemical weapons. For 4 years the war had waged, and now it was ending. With it, it had taken the empires of old. The Russian empires, the Germans, the Austrians, the Turks, all of these empires were starting to fall, and in their wake, smaller countries were coming up, and they were beginning to make peace after 4 years of war. And so 1918 really was a critical moment. This was the year that everybody was finally looking for peace, an end to death, safety. And on this side of the Atlantic, President Woodrow Wilson had spent pretty much his entire presidency fighting the Great War in some version. And he started 1918 by offering his plan for peace on January 4th. This public appearance on a global stage for a European conflict was really an arriving moment for the United States. There was nothing like it. This was our moment to shine. And this had been building for years, ever since the defeat of the Spanish Empire in 1898. So we had to make very smart decisions at this very critical moment. Part of these smart decisions were making sure that Americans were absolutely committed to the war. We couldn't jump into the war and help save them if Americans got tired after 9 months. So we had to make sure they were in it for the long haul. And for this, we would need propaganda. In 1917, President Wilson used his executive authority to establish the Committee on Public Information. This was the first propaganda board in the United States. Throughout the war, it worked closely with news outlets to publish favorable news stories for the war and the government. This board worked hard to ensure that Americans were regularly reading news that was crafted by, and sometimes created by, the US federal government. So to recap, it's the eve of the pandemic, and here's what we've got. We've got 4 very important things happening. 1, we have a war that is 4 years in the making and has wreaked death and destruction, the likes of which no one had ever seen, and people were ready to be done with it. Number 2, we had a tenuous peace that was ready, that was close, super close, but we couldn't show weakness. We had to show absolute strength the entire time. Number 3, we had a country and the politicians in that country that were on the brink of global notoriety. They were on the brink of being the next great power. That's the United States. And it had to do everything so correctly over the coming months in order to keep and hold that power. And the 4th and final thing, that country, the United States, that was so close to getting these huge ambitions, had the power to control the news and control the information that people saw. So these 4 things all culminated into what we're about to talk about and what we're about to see with the Spanish flu. So when a mysterious sickness came through, beginning in the spring of 1918, the powers that be did nothing. For 6 months, the British, the Germans, the Russians, they all ignored it. The US used their laws and committees to lock down any mention of the disease, or at least whitewash it. In a remark reminiscent of today, the US Surgeon General even called it nothing more than the flu, the regular flu. So in the absence of any real guidance, the world waited. And while they waited, while they focused on the human enemies, while they focused on getting good peace terms or propping up economies or making political leaders look good, while they did all of this, the real enemy prepared. And in the fall of 1918, it was ready for its death blow, its fatal attack. And for that, I gotta go get more pictures. And in 1918, just 6 weeks before the armistice was signed, the tinderbox that was the Spanish flu lit. And with it, the United States was engulfed in it. The United States and its cities would spend the next couple of months bumbling their way through this without an actual plan, making mistakes, costing lives, mistakes that hopefully you and I can learn from. In September 1918, the flu took its first hold in Boston. Within just 13 weeks, the pandemic would run through its hottest phase, killing more Americans in October 1918 than died in all of World War I. In fact, the total death toll estimates range from anywhere from around 200,000 to 675,000 American deaths. As fast as this seems, though, there was a buildup, a week or two where public knowledge and action might have helped slow the spread. But the papers didn't report, the experts weren't listened to, and the politicians didn't act. The flu start in Boston was simple. The first recorded case was on August 27, 1918, when a sailor reported flu-like symptoms. Within 5 hours, 28 fellow soldiers would become infected. Within a few days, the flu would be taken to Boston's Camp Devens, where the Surgeon General remarked on the, quote, bodies stacked like cordwood. But you would have never known the situation was so dire, because it wasn't until 2 weeks later, September 13th, that we started even seeing evidence of flu in the newspapers. Even then, it was smaller and seemingly hidden, never on the front page, and never in big titles. But as we know today, ignoring something doesn't make it go away. Within 2 days, schools would be closed. Amusements like theaters, parks, boardwalks, all closed. The governor would call on all nurses and doctors to help. They were taking the right steps at this point, but over a month after the flu started. By the end of September 1918, there were already 14,000 cases in Camp Devens alone. That's not even counting Greater Boston. In common words, the actions of the state were too little and far too late. And so it was that the flu began making its journey to the rest of the United States. Its next stop would be Philadelphia, where there was a parade coming. One of the most basic choices a leader has to make during a pandemic is this: money or lives, health or economy. That's the choice. To beat an infectious disease with health, you have to keep people apart, but an economy requires keeping people together. And therein lies the rub. You have these two seemingly different things that are mutually exclusive. And while common sense and logic tell us that lives and health are by far the most important decision to make, and the most important thing to keep, sometimes we found, in history and in current events, that it's very difficult for politicians to actually make that decision. And for some inexplicable reason, it's very difficult to say no to the dollar, and such was the mood in Philadelphia in 1918. The city was set to have a war bonds parade, designed specifically to encourage folks to buy war bonds. Remember the huge costly war that the world was involved in? Well, it needed money. And there was a lot of pressure to keep these parades going. So when the flu jumped to civilian populations in Philadelphia on September 21, the public health department chose to ignore it. The director, Wilmer Crutzen, told the public to just keep warm, stay dry, and I joke you not, keep your bowels open. So bundle up and take a laxative. And also, don't forget to buy war bonds. Public health experts, actual experts, not political figureheads, eagerly encouraged Director Crutzen to shut down the parade. But bowing to political and economic pressures, he didn't. And so it was with that Liberty Bond parade that Philadelphia became infected. Within 72 hours of the parade, every single Philadelphia hospital would be maxed out. 2,600 people died within a week of the parade. Despite an immediate quarantine, 12,000 citizens would die within a month, with 16,000 Philadelphians eventually giving their lives. So here is another case of the right measures going into effect, but way, way too late to make a difference. But maybe it was just bad medical care, you might be saying. This is confirmation bias coming through. I can hear some of our longtime viewers saying this, confirmation bias, confirmation bias. Fine. How do we fight confirmation bias? We do it by proving ourselves wrong. So how would we prove ourselves wrong in this case? The the main way to do that would be to find a city that did enact these social distancing and closing down procedures. And if they did do that and were able to evade the deaths that Boston and Philly came to, then maybe there's some water to our argument. And is there a city like that? Of course there is, because science, we know there's a city like that. And for that, we're gonna go to St. Louis. To be fair, St. Louis has some differences. To start, they had a very different health commissioner in Dr. Max Starkloff, who was active and communicative, and also pretty attractive. Before their first case, he wrote an editorial in the newspaper encouraging folks to avoid crowds and stay indoors. Moreover, they acted upon receiving their very first case. They didn't wait for deaths to pile up. As soon as they got a case, they acted. When that happened, Dr. Starkloff immediately shut down pool halls, theaters, and public gatherings. When the cases started coming in, patients were treated at home by volunteer nurses and doctors instead of bringing them to the crowded hospitals to spread even more. And of course, the question on all of our minds is, did any of this help? Yes, it helped because, again, science. We know these actions help. A 2007 study actually compared Philadelphia's worst death rate with St. Louis's, and after adjusting for population, found that Philadelphia's deaths were 8 times higher than St. Louis. 8 times. They didn't use different medicines, they didn't use different techniques, they didn't have different technology, they weren't developed in a different way. There were no other technological or scientific differences, just a faster, more data-backed response. Like St. Louis, San Francisco also adopted early protections. They closed schools, banned social gatherings, pool halls, theaters. Moreover, they passed a law requiring everybody to wear masks. And so they did. Until November 21st, 1918, when bells rang throughout all of San Francisco, signifying it was time to take off the masks. The flu was over. The pandemic was done. And one newspaper, actually, an editorialist wrote in a San Francisco newspaper that the streets were littered with the debris of this dangerous and terrible time. People just took off their masks and dropped them in the streets. And with that, the flu was over. As the quote famously goes, on the 11th hour, the 11th day of the 11th month, the guns of World War I stopped firing. The hospitals of the world were beginning to gain empty beds. The dead were finally being buried. The pandemic was over. Death was over. 1918, that terrible year, that year of hell, that year of endings. The Great War was supposed to be the war to end all wars, and I imagine, having gone through the pandemic, many folks would feel a similar hope, that it was the pandemic to end all pandemics. And so it would be, I presume, that the world would look on graciously to the end of 1918, not only the end of war, the end of the war to end all wars, not only the end of the flu, the end of death. But it wasn't to be, which is what this guy is going to help us understand. It's hard to kill a virus once it's in a host. They're not like bacteria that we can just throw an antibiotic onto or some silver nitrate. No, the best way to fight a virus is to vaccinate against it, to teach our body how to keep it out. And we can only do that by catching and surviving the virus, which is what typical vaccines do. Once a critical threshold of people gain immunities, we develop what's called herd immunity. This just means that so many people are immune to the virus that it can't get a good foothold. In most communities, it's 70 to 80%. You'll hear most experts say that when 70 to 80% of the community has the antibodies to a virus, you have herd immunity. So absent a vaccine, or absent a large portion of a population having been exposed and defeating the virus, it will come back. That's just what viruses do. Or as us millennials learned as children,
life finds a way.
And so it did. In January of 1918, just a few months after San Franciscans took off their masks, after St. Louis relaxed the requirements, the disease came back throughout all of the United States. This time it was fueled by the combined double threat of 1, the people itching to get outside, and 2, political leaders hesitant to risk the economy again. So when public health experts advised folks to social distance again, few cities and states actually listened. And without a federal mandate, the third wave of the flu came. When the news came that the virus was back, San Franciscans picked up their masks and put them back on. But by now, having been shut down for months, they were hesitant to shut things down again, so they kept theaters and schools and pool halls open. They went from escaping a huge burst of the flu to having one of the highest death rates in the nation. In fact, a 2007 study looked at the data and came to this deadly conclusion. Had San Francisco kept their same social distancing policies for the spring wave, they would have cut their death rates by 90%. 90% just by doing something they had already done. Viruses are weird. They're not something that we can just outrun or hide from. We might miss a wave or two, but until we develop that herd immunity, we will never be rid of it. That's just how they work. And we knew that in 1918, but we still chose to ignore it. We know it now, and the jury's out on how we're going to respond to that information. And now we're back to where we started, with the picture of Mark Twain and the quote, the meme that we initially saw, that history doesn't repeat itself, but it does rhyme. And while Mark Twain never said this, we do attribute it to him, and it has become something that I believe wholeheartedly, because history does rhyme. And right now, we are rhyming quite a bit with the events of the Spanish flu in 1918. Both times, now and 1918, saw a massive pandemic cover the world. Both pandemics see a less active federal government. Both pandemics see a patchwork of different choices across the country. Both pandemics were worsened by choosing economy, morale, public standings, political considerations over lives and health. And both pandemics are coming to a deadly peak. 1918 saw theirs in October, ours is occurring presently in April. So what do we do with this information? I would posit, let's start by asking, how did you feel when you heard about San Francisco? How did it feel knowing that they'd survived their first round just to be defeated in the next? We must learn from our mistakes, and we must not wait. So here are my concrete asks. There's 4 of them. Number 1, don't panic. I know that's easy to say, but truly, the more we panic, the less we engage with our neofrontal cortex, the fewer rational decisions we can make. So try really hard in daily situations not to go to that panic place. Find out whatever it is you need to do to make sure that you're staying calm and level-headed about things as much as you can. Number 2, this to me is the most important one. Know that we have all the technology, all of the medicine, all of the science to defeat this. Just like in 1918, we know how to defeat this. The science is pretty simple and it's also very clear. This isn't something that we don't know about. This isn't something we don't have the technology to defeat. We do. And that makes me feel better and should make you feel better. Number 3, listen to the public health experts. Here in a couple of months, in May or June, we most likely will get an all clear. That also will most likely come with the caveat that at some point we have to go back in to social distancing, just like with San Francisco in 1918. Remember, that's how viruses work. You don't just escape them. They will keep coming after you until a vaccine is developed. So when that all clear comes in May or June, make sure you're also listening to the public health experts. Listen to what they say. And when they say it's time to go back inside, do it. Don't wait for the political leaders. And number 4 is the same as number 1. Don't panic. Hopefully, asks number 2 and 3 helped solve that. We know we have the science to defeat this. We know how to defeat it. We can start doing it today. We have the people that can tell us how to defeat it, the public health experts. So those are my asks, along with the ask that I ask every week, which is be kind to yourself and the people around you. Thanks everybody. Have a great week. Stay safe. Take care of each other. Bye. But as we know today, ignoring something... Wait.
New York Times notification. People have been burning cell towers in Britain. Officials say it's because of a baseless conspiracy theory that 5G technology spreads the virus.
Okay, I like that one better. Cool, that's it.